Good afternoon, and thank you so much for continuing to keep us company. We are going to move straight on to our next session, which is the impact of COVID-19 and women transport workers' rights. And this session is going to be facilitated by Anna Karume, who is from International Transport Workers Federation. Anna?
Nice Amon. Nice is from the Tanzania Communication and Transport Workers Union. She is an Assistant Secretary General of COTUT, that's the union. She has served in the union for 4 years. She has great experience in organizing the informal sector and the formal sector. She is also good in organizing the bus rapid transit system that has taken off in Tanzania, and we admire and we always like replicating what Tanzania is doing. We have Aisha Nateza. Aisha is from Uganda. She works with the Kampala Operators Drivers Association as a chair, and she's also the chair of the Women Taxis. She's also the chairperson of the Amalgamated General Transport Workers Union Women's Committee. Aisha has great wealth of experience in this field. I will introduce Anna Kazombe from Malawi. She's a senior trade unionist. She's the Deputy General Secretary of the Transport and General Workers Union of Malawi, and she's also takes care of the women affairs, and will be joining us later. She's having some internet connections. We have our sister Salami Adamola. She's the head of the International Affairs and also the head of Women Affairs. Salami has great experience in also dealing with international affairs and women affairs in Nigeria. And she is also one of our contact person in Nigeria in the ITF. We have our sister Rebecca Kweshi. Kweshi works with Metro Mass Transit as a senior planning officer. She is the chairperson of the Women's Committee of the Ghana Transport and Chemical General Workers Union. Rebecca also has vast of experience in transport issues and women issues in Ghana. We have Judith Lusaka. Judith is a member of the Kenya Railway Workers Union. She works for the railway, what we call the standard gauge railway. She works as an assistant attendant in the signal operator. These are some of the women like Judith who have taken the roles that were previously held by the men, and she's also a shop steward. She's an active member in the ITF activities. We have our sister Beatrice Sifwada. She's from South Africa, from SATAU, the South Africa Trade Union, the South African Transport and Allied Workers Union. Beatrice has served in several positions, both in the provincial structures, and she's also the provincial chairperson. Now Beatrice heads the gender department of SATAU, one of our strong affiliates in Africa. We also have Naomi Njeri. Naomi Njeri has worked in different circles in the informal sector here in Kenya. She's also a member of the steering committee of the Bus Rapid Transit in ITF here in Nairobi. She has vast experience in working with the informal sector and working with the women. So we are going to have women. These women are going to discuss, and we're going to give them 3 minutes each. We shall start with our sister Rebecca from Ghana. Rebecca is going to look at the issue of the impact of COVID, and she's also going to share her experiences when it comes to the personal protective clothing in this era of COVID. So welcome, Rebecca. It's your turn.
Good afternoon, comrades. Yes, the issue of PPEs. As we all know, the transport has been mainly men-dominated. And because of that, when women came into the transport business, PPEs became an issue in that when you come, what is there is what you have to use concerning the overall, the boots, and some the women in the workshop, that is the helmet they have to use. So when the union instituted the women's committee, the women's committee came in, sat down with management and looked at the issue of women and then PPEs. First, the PPEs come in not tailored made for the women in the organization. But as the union came in, we were able to negotiate for a local manufacturer to take over the provision of the PPEs. So now we have women taking their measurements so that whatever comes in fits them as they like. So we really appreciate what the union did, because sometimes you have to use the washroom and the men's overall is just the bottom up. And then during break time, when women have to also breastfeed their babies, those who have nurseries around will have to go and then take care of their babies. So all these issues were taken into consideration because the Women's Committee was put in place and the women had a seat on the decision table to decide on what is good for the women. Now let's look at the COVID, the impact of the COVID. Because of the COVID-19, most women have to leave their babies home and come to work. And during this COVID time, all schools are closed down. So it's not easy for them to come to work and then leave their babies home. So the union came in and then negotiated that these women should be working. Some were working from home, others will come on shift basis. And then the PPEs too, we were able to negotiate for them to get the nose mask, the ticket clerks, the cashiers, and then the conductors were provided with gloves and hand sanitizers, the packet one and then the big one, washing basin for washing their hands, soap. So this is what was put in place because the union stepped in to speak for the women for COVID-19 protocols to be observed so that we can protect them. Because the women are mostly the front line. They meet the public, they sell the tickets, they take the money. So they were really at risk during this COVID-19. And I will say that the union has done a very good job by stepping in and also negotiated on these items, which wasn't even part of our CAs. And I'm happy to also say that because of the COVID-19, we now have the occupation health and safety committees put in place in our various organizations so that they will look at these things. And now PPEs are part of the issues in the occupational health and safety issues to discuss. Thank you.
Thank you very much. Thank you very much, Rebecca. We have had you loud and clear. We are happy that we have had the union has been engaging during this COVID. Women have been able to get the right size of PPE. And we have also had that we also have a health and safety committee in place, and women are in the negotiating team, and we have had that there is consideration now. Aisha, the floor is yours.
Yes, just now. Before COVID, we had so many women driving and some others were conductors. When COVID came in, so many women lost their jobs, especially younger women. People used to work from morning up to night. But these days, women, they do not have anything to do because so many of their cars did not come back on the road to work because of the blockages they got, the mechanical problems. And others where the government putting more, how they call it, more regulations which are affecting this. So many women in our society, which they cannot afford to do what? To cope with. Secondly, those cars were not owned by what? By our ladies. These were owned by men who are really taking disadvantage of us. If you want to go back to work with them, they have to ask you, which is not good to our side. There is insecurity in the transport industry. We are not secure enough, whereby all women, you come today, the following day the man chases you, unless otherwise you have accepted what he has here. We want to tell you. You understand that? You have that big job insecurity. Even payments are not the same. The way they pay the men are not the same as the women. That's another problem. There's nothing which the government has done for us, especially after COVID, because immediately after COVID, we've got another problem of presidential campaigns which have started. No office now at this time working our issues. We have to wait until the president, we have elected the president and other leaders. That's when we can go on with our issues. So all this period, we are going to be stuck in our lives. No money to look after our kids. During the COVID time, there was domestic violence of, of us at home. People men used to beat women, used to abuse what using vulgar language. Some men tend to live at their homes, leaving the women look after their kids, which is very tiresome. And this led some of the women to force their girls to go in the forced marriage, which is a very big problem to us. And many of them have got pregnant and are not going back to school. It's a very big problem to us. It's just recent when our union, Amalgamated Transport and General Workers Union, try to take these women for training. Here in Uganda, we have only 5 women who have gone for training to train for those buses, and it's very very expensive. Our union has no money. If we can get someone to support our union so that they train more girls or women in that system of buses, it will be very good, because the permits they are allowing a person to drive is very high, and women cannot afford to get money to get those permits, which is very advantageous to us. Women who used to sell food in our parks and whatever, they've also lost their jobs, because the people are very few in Kampala now. In addition to the COVID problem, we have the political instability in the country now, whereby no office can now attend to our issues. We have to wait until we have elected the president, and that's when we can come back to the situation. So we need your help.
Thank you, Aisha. Your 3 minutes are over.
Yeah.
Thank you very much, Aisha, for your presentation on the loss of jobs. We have heard that many women, young women, the food vendors who are women have lost their jobs. We have also heard that some of the women lost their jobs because when the cars were off the road, the government put in
Mechanical
new
problems.
regulations able to afford, so less job. I've also heard about the sexual harassment in the sector due to COVID, scarcity of jobs. We have also heard that there is violence now going on, and we have forced marriages. We're happy to hear that some training would be going on from the union, and we shall what has been working. And there's also the issue now because the jobs are scarce. Thank you very much, Aisha. Thank you. Thank you very much, Aisha. Now I will move to Judith. Judith, you have 3 minutes to tell us the impact of COVID with the reduced earnings.
Immediately COVID-19 struck, we were forced to go on compulsory leave. And after a month, there was a circular that was sent indicating that there will be the implementation of pay cuts from 100% to 50%, and lastly, the 30% of the basic salary. This directive brought about a lot of uncertainty with the employees, as the 30% fraction was unsustainable with the high cost of living. Considering all workers are under contract, we felt unsafe and not protected by any laws or bodies, yet the pandemic was a natural occurrence. The 30% cut of the basic salary was not negotiated. People had to leave the city as they could no longer offer the paying rent and providing for their families. So some of the impact to women were Most of the women were sent off and put on the pay cut, hence making their livelihoods unsustainable. Um, this has also cut off employment benefits such as house allowance and medical insurance. With pay cuts, we also had an increase or experienced an increase in the domestic work burden for the woman, because especially for women who are breadwinners, you find that they'll have to go out of their way doing extra domestic work, which was also hard at the time because of social distancing and trying to implement the COVID-19 precautions that had been administered by the Ministry of Health. Another thing, some security, because policies to protect women employment were not in place. And it was at this point, because we found out that a lot of women were at home for a period of like 7 months. We had to involve the union to step in, so that they could try and negotiate better working conditions for us, especially during this time of the pandemic. So the union, through the gender docket, was able to negotiate the terms with the employer. Instead of employees being laid off, this percentage was negotiated, and we were able to benefit instead of staying at home empty-handed. Also, staff were also able to resume work in batches, hence ensuring they secure their livelihoods and their jobs. We still have a few who are not yet resumed work, but we are hopeful that the union will step in and ensure that everyone is back at work. So at the moment, we'd like to appreciate the work of the union, but also try and request that more women can be put in the negotiating table so that they can help us not to undergo such a predicament again. I guess that's all.
Okay, thank you very much, Judith. We have
Okay.
had how the impact of COVID resulted to you guys, and particularly the women, having a pay cut reduction from 100% to 30%. We've also heard that the 30% was not sustainable. This also added more domestic work to the women workers, because for sure they would not even afford a health help. We have heard that some of the workers, particularly the women, were forced to move out of the city because the living standard was very high, they could not afford. But we are happy that your union was able to negotiate, and most of the women or the workers have come back in bunches. And we have also heard there was a loss of employment benefits, and we hope that everything will be fine. Thank you, Judy, very much. Let me now call my sister Anna from Malawi. Anna from Malawi, it's your turn to talk on the impact of COVID and the increase of violence. Anna from Malawi.
My name is Annie Kazembe.
Yeah.
I'm the Deputy General Secretary of Transport and General Workers Union in Malawi. My presentation is on the impact of gender-based violence in the informal sector in the time of COVID. So in Malawi, due to the unemployment rates, they are so high. And apart from that, most people have not gone to school. They've got low education. As a result, most women have gone into small-scale businesses. And these businesses, they are cross-border businesses. They usually travel to countries like Zambia, Tanzania, and South Africa. So due to the COVID pandemic, Malawi was declared a state of disaster, closing down borders and airports. And this affected women greatly because their businesses came to a standstill. Now, because the businesses came to a standstill, women had no means of getting an income. And therefore, most men, they took advantage of that, and they started sexually harassing women so that they can at least get a little something to keep them going. So most women are being sexually harassed, and because of the COVID in Malawi, the sexual harassment thing has come. It is so bad. It's really on the rise. And apart from these women that do small scale businesses, even women in the formal sector, they have been affected both economically and socially. Companies are closing down. For example, in the aviation sector, we have airlines that were closed. No aircrafts were moving from into Malawi and out of Malawi. As a result, companies like Malawian Airlines and these handling companies, air cargo, they had to scale down on workers to downsize because they didn't have enough money to pay the workers. As a result, most of the people that were affected were women. I don't know whether it is culture. Here, they prefer men in the workplaces than women because they feel women have got a lot of excuses. So, no, I'll not come to work because my child is sick or my husband is sick. So we are saying even the women in the formal sector, they've also been affected because companies were downsizing. And because of downsizing, most women have lost their jobs. As a result, because they need to find a way of survival, men have taken advantage of these women and they're being sexually harassed. So basically, that's the situation that we are in Malawi.
The closing of companies have affected the women. We have heard about increase of violence because of reduction of finances in families. We have also heard about the violence and sexual harassment. Thank you very much, Anna, for your contribution. Let me now call Sister Nice from Tanzania to talk about the impact of COVID and sanitation among the women. Sister Nice, Tanzania.
Thank you so much. As my experience, I'll be talking about women who is working in transport sector, sanitation, especially toilet issues. Sanitation in public toilets in Tanzania is a very big challenge because most of toilets have no enough privacy. You know, as women, we need more privacy compared to men, and no running water enough. And as we know, all of us during this pandemic, we really need environment to be clean because Corona is very, very dangerous. And bad enough management of used sanitary pads is very, very poor. Was enough, very even with BRT stations, no toilets, leaves away the traditional bus station. Inadequate or not provided of sanitizers. As we know, most of people we need sanitizers, but this public toilet, there is no enough sanitizers. And another thing, some women, they hold on their needs to put themselves in the bushes for feeling infected because of being bad or in unclean environment in the toilet, public toilet. But men are relatively affected as they have option to pee under trees or in the corners, which is impossible to most of the women, according to the way we are created. All in all, women, they are in high risk to get infected because coronavirus, it is a disease which that requires the environment to be clean. So far, the union, we made an effort to educate people and workers, especially food vendors, conductors, and drivers, and some commuters who are around of the buses to just use ourselves to educate them about the impact of Corona. And we try to advise the government to take some more measures like adding more sanitizers and putting a lot of water, which will be helping people to wash their hands, and a lot of soaps, And all in all, to make sure they take action to make sure people they have distance and they have enough security to make sure that all precautions are taken. So that so far that the thing we have done in Tanzania.
Thank you, Nice, for your presentation. We have seen the impact of COVID in sanitation, lack of toilets in most of the bus stations. We have had these inadequate sanitizers in the public toilets. We have had the challenge women undergo, especially when they lack the provision during their monthly periods, they have nowhere to change. We have also heard about the high risk of infection towards the women. But of course, we are happy that the union has taken up the role of educating the conductors, the commuters, and the food vendors on clean hygiene. Thank you very much. Nice. Thank you very much. Let me now call our last panelist that in this session. It's Salami from Nigeria, who will talk about the accelerated digitalization. Salami, it's your turn.
Good afternoon, Sister Anna. Thank you. In Nigeria, the impact of COVID-19, then the aftermath of it is the accelerated digitalization. Because already, by the time before COVID-19, the government is put a policy in place which is just in phases, trying to go cashless. So we discovered that after the COVID-19, the government became very strict about cashless policy. And most women in the transport sector, yeah, we have drivers, but some of them are ticketing officers. And with this cashless policy, some of them are totally out of job now, because the government is trying to make sure that the contact between woman being is being reduced. And because of this, there's no need for ticketing. Women are mainly ticketing officers in most of our bus stations. And some of them, as it is now, are out of job. Or some of them their working hours have to be reduced. Maybe they have to work few hours or few days in a week. That is an area where the employer is being considerate that they should not lose their job totally. Also, most women during the COVID-19 lockdown, there was total lockdown, no movement. So most women during this period lost their job. And we could see that men took the advantage of some of these mobile apps or this mobile platform like Uber, Bolt. Most men could be able to get one or two, those food vendors that need to deliver food in one of the area where government is giving them palliative or things like that. But most women are out of this because some of them could not even afford Android phone or smartphone for them to access this mobile app, because you need this mobile app for the vendors to contact you and say, okay, you can come and deliver goods in so places. So the effect of digitalization on women in Nigeria is so much that most women now are out of job. And already the union is trying to has already approached the government for a kind of palliative for these women, especially, and the other drivers in general, so that they could easily come out of this. Because we noticed that after the pandemic, when the lockdown was eased gradually, most women, while we went to the field, most women that we talked to, they could not come back to field. One, because some of them, most of the vehicles they are using, they are on hire purchase, and they could not meet up because of the lockdown. And the owners of the vehicles are not ready to listen, and it's not even giving them opportunity. Maybe because they see they are women, they might not be able to work for longer hours, so for them to recoup all this money they've lost within the period of the lockdown. Also, during the lockdown, we noticed that there were a lot of increase in gender-based violence, because women have to be at home. Sometimes they use this opportunity to go out and earn living. Most of them are breadwinners of the family, but because of the lockdown, they could not even go out. So this makes them to be in the house, just managing themselves with the violence. Because even the Ministry of Women Affairs in Nigeria reported that during this period of that lockdown, the rate of gender-based violence was so high that the government too has to even alert that what is happening. So women, the union also try as much as possible to reach out to some of these women and see that, okay, like the cashless policy, if there could be a kind of shift in the work they do, so that at least few of them too can come back on board. Yes, for the informal sector, with the ticketing policy is not 100%, but the government is really hammering on the union. And by the time this is 100%, we'll still lose more women because they are more at the ticketing aspects of the transport sector. So we don't know what will be the fate of some of the women, the few ones remaining in the ticketing sector, because the government is so particular about this cashless policy. And also another thing is the spacing, social distancing, because by the time you have to load, you cannot load the number of passengers you used to load before. But for the men, they were able to maneuver, but women could not really maneuver this. And some of the owners of the vehicles are using that one against the women. Okay, in rounding up, we notice that most women are not that IT grounded, because some men that lost their job because of the cashless policy, some were able to still fit in one area, in one aspect of ICT or the other. But because some women are not that grounded in ICT, some of them have to lose out totally. So I believe and I hope that if women could be encouraged and support for them to have more training in whatever way, whether it's ICT or any other way, for them to secure their jobs. That security of their jobs should be our major concern. The union is trying to speak to the government, to speak to the employers, but there's little we can do. If we still have this support, we'll be able to go far. Thank you.
Okay, thank you, Salami. That was a well elaborate. We have had the loss of jobs for women due to digitalization, the issue of most of the women who are acting as ticket officers. When the cashless policy has come in, most of the women has lost their jobs. We have also heard about the digital hire, what we call the Uber. Most of the women lost jobs because they could not really work as hard as expected by the owners of the car to return the gains. We have also heard that most of the women, there was an increase of gender violence. We have also had the lack of jobs because, of course, we know most women may lack the skills, and with the gender policy and the cashless policy on reduction of contact with the passengers, there was, of course, less loading, and most of the time you'll find that it's women who are affected. Thank you very much, all panelists. We have come to an end of our first phase of our recording and our session. We are now going to watch a film. This is a film that was filmed in Kenya in the middle of the lockdown and curfew, and it really shows the impact of women conductor. So we get prepared to watch the film.
Naamka asubuhi saa 11, natayarisha chakula cha mtoto, alafu natoka naenda kazini. Kwanza mapato imekuwa hamba, sababu unapata kwamba wale watu wenye wanatupea kazi, wengine wakati janga hili litokea waliamua kuuza magari. Kwa hivyo wengine wetu tulibaki bila kazi. Sasa inabidi sasa unatafuta kazi ya kurelieve wale wako wamesalia kazini. Sasa kama mimi nilikuwa na gari yangu permanent lakini iliuzwa. Sasa huwa na tegemea wenzangu wanipatie kazi ya relief, pengine siku moja ama siku 2 kwa wiki. Nasikia serikali huwa inapatia watu barakoa na sanitizer, lakini mimi sijaziona, na hata wajiri wetu wakati mwingine wanapuuza. Sasa inabidi tunatumia pesa yenye tunapata kununua sanitizer na mask, na hiyo pesa urejeshwe sababu mwenye gari bado amekuwekea target na ana expect ufikishe target yake. Hakuna kabisa, sababu hata hizo leave hakuna. Unasimamishwa kazi ghafla. Kama ulikuwa umejiwekea pesa unaweza saidika, lakini kama hujajiwekea unaumia tu. Kama mtu amegojeka ama hayuko kazini, hawezi saidika na lolote kutoka kwa serikali, pengine asaidiwe na watu wao ama yeye ajue venye atajisaidia. Unatagamana na watu wengi, wakati mwingine hata hizo safety protection gear huna, na bado unaharasiwa na polisi na kajo. Hayo mambo yanakufanya usikie huyuko salama kabisa. Nitazuia kabisa kwa sababu kwanza kazi hakuna. Wale wanawake ambao wako kwa transport tayari wanasimamishwa, kwa hivyo hatukutakuwa na nafasi zingine za wanawake kujiunga na sekta ya transport. Ningependa kuwahimiza wanawake wote ambao wanafanya kazi kwa transport waweze kushirikiana, na pia waweze kuelimisha wengine, waweze kufuata maagizo na kufanya mambo mengine ambayo yatatusaidia ili tusiambukizwe hii ugonjwa wa corona. Na pia wanawake na wakumbusha waweze kujiunga na vyama, wale wamejiunga wabaki katika vyama sababu vinasaidia. Kwa sahi mambo ni magumu, na siku zijazo sijui kama kutakuwa afadhali. Kwa hivyo sina matumaini.
Thank you very much. We have all listened to the film. It really illustrates how women have suffered during this COVID. It was well elaborate. We all had and we saw what the impact of women, the impact of COVID is during this time. That's a woman conductor who has really illustrated how the women have been impacted by COVID. We shall now move to our next session. And let me take this opportunity to introduce Claire. Claire Clark is the Assistant Gender Policy Officer based in London. to make her presentation. Welcome, Claire.
Thank you, Anna, and hello everyone, and thank you for this opportunity to talk through the 9 key areas for action for women transport workers that the ITF has identified as part of the immediate and longer term COVID-19 response and recovery. So, as has already been highlighted, whilst all transport workers are being severely impacted by the COVID-19 crisis, we know that the gender segregated nature of our industry will mean that there are specific and additional impacts for women transport workers. And there is scope for the challenges arising out of this crisis to put an additional strain on existing inequalities. So it's imperative that the global narrative and response does not exclude women transport workers, as can so often be the case. And this is no small challenge for any of us, particularly at a time when parts of the industry are fighting for survival. The ITF statement sets out 9 key areas for action for women transport workers in the COVID-19 response and recovery, and includes key demands for employers, governments, and investors negotiated with unions and with women's participation to protect and enhance women transport workers' rights. The first area to focus on is the health and safety measures that are implemented in response to COVID-19. Health and safety is paramount. Transport workers must be adequately protected so they can carry out their work. And this means working conditions that minimize virus transmission and the provision of PPE in accordance with the ITF Global Charter of Demands to keep public transport workers safe from COVID-19. And for women public transport workers, these measures need to be gender appropriate. In other words, PPE that is suitable for women's bodies. There also needs to be safe access to water, sanitation facilities and breaks, an aspect which was already a major issue for transport workers with specific impacts for women transport workers, and is now even more critical, particularly given the shutdown of many public spaces often used by transport workers. And the process must take account of specific needs of transport workers, such as menstruation, pregnancy, disability, menopause, and pre-existing health conditions. Violence against women has increased during this pandemic and will continue to escalate as unemployment, financial strains, and insecurity increase. In more isolated work environments, women may find themselves at increased risk of violence at work. For example, workers in customer-facing roles may be facing increased risk of violence from the public. Scarcity of work is amplifying existing risks of sexual coercion, and isolation and curfews are exacerbating domestic violence, and economic impacts have hit survivor support services. Safety measures are therefore even more critical, including meaningful and relevant support for survivors of domestic violence and safe commuting measures for transport workers to and from work. We also need to lobby our governments to urgently ratify and effectively implement ILO Violence and Harassment Convention number 190. Our research evidences that women's jobs in transport are more likely to be vulnerable to the impacts of automation and digitalization. And as many cities introduce accelerated digitalization of ticketing and payments, for example, as part of the response to COVID-19, while it's too early to say what the impact will be, there is potential that there will be continuing impacts for women. So the ITF is calling on employers and governments to ensure that any measures implemented in response to the crisis, including the introduction of new technology, must benefit, not cost women workers. And unions must be included as key stakeholders in consultation on all new technological developments in transport. There also needs to be strong income and social protection measures in place, such as healthcare benefits and paid leave, including for sickness and caring responsibilities, so women are not forced to choose between their family, their job, and their health. And there are many aspects of the crisis that women face specifically and/or disproportionately. Employers and governments must recognise the extra care burden on women and provide additional protections, including paid leave for pregnancy and childbirth and for caring. And without strong protections and secure employment, many women may find themselves pushed out of the industry. Overrepresentation of women in precarious and informal work means more vulnerability to layoffs, cuts in working hours, and loss of earnings without proper social protection and/or compensation. Or they have no choice but to continue to work in order to earn a daily wage, despite the potential risks to their health. Along with social protection, the transition of women workers from the informal to the formal economy is critical, including reskilling women transport workers into new occupations in the industry. Fundamentally, we need to make sure that our strategies are gender responsive. Recognizing how COVID-19 is affecting women and men differently is essential for creating effective and equitable policies and interventions, which will result in better outcomes for women, but also for everyone. Gender disaggregated data and gender impact assessments are critical to ensure that policies, strategies, and measures are evidence-based to meet the needs of women transport workers. These gender impact assessments and gender responsive criteria also need to be included in projects and loan programs that are set up in response to the crisis. If there is going to be investment in public transport, how do we make sure that this is linked to the creation of jobs for women? Finally, representation of women in decision-making is critical to ensure that strategies are gender responsive. The evidence is overwhelming. When women are not represented, the issues that impact them specifically or disproportionately are not addressed. With low levels of women's representation in industry decision-making bodies, there is also cause for concern about the long-term impact on women's participation in the industry. So these demands are in response to the current COVID-19 crisis. However, the issues they address are long-standing. After COVID-19, we cannot go back to a normal, which for many women transport workers means precarious work with no income or social protection, being underrepresented in leadership and decision-making, facing violence at work and at home, and sanitation indignity. This is not normal. Instead, as we emerge from this pandemic, we have an opportunity to ensure that transport is organised to meet social and economic priorities, that existing women's rights are reinforced, that changes do not build on existing inequalities, and that there is a gender equal new normal that guarantees good jobs for all workers. Thank you.
Thank you very much, Claire. Thank you very much for being very clear. It's imperative that the transport industry, including employers, government, investors, and unions, action a gender responsive approach to ensure that inequalities are not reproduced, perpetuated, and intensified. Has identified provides a strong framework to do this. We are now going to hear from our two women leaders about the action day 19 for women working in the public transport. With that, I want to introduce our sister, Beatrice Sifada from Satau, South Africa, for her to talk about formalization.
Yes, thank you, Comrade Anna. Thanks for the opportunity. Yes, I think I've lost the last part of your contribution. So as Satau in South Africa, the COVID-19 and the public transport in South Africa is yet to be integrated. Hence, in South Africa, there's support to Uber drivers as opposed to other countries. And in terms of public transport, particularly the taxi industry, is in the process of formalization in terms of the recent taxi indaba that we've recently saw in news, driven by one of the sectors, one of the skills in South Africa, which is TITA. Women are a handful in the taxi industry. However, they are on the indirect role in the industry through vendors, your hawkers in the streets. So SATAO supports the formalization of workers, taking into consideration the shrinking of various industries, ranging from your trucks and your bus passengers. SIA has indirect outsourced its core functions. This led to its collapse. Comrades, we are aware that SIA in South Africa has closed down. Even the treasurer and the government, they are trying to rescue that airline. And we are so hopeful as SATAO that as the new SIA will not be outsourcing the majority of sectors, your security and cleaners. And we believe that those workers will be permanently absorbed by this new airline. And the formalization of employment has advantages on who were previously disadvantaged, as I earlier alluded on, that the new airline, SIA airline, we strongly believe and will be there advocating that SIA must absorb these workers. And we know security and cleaners is female dominated, and they will be at the advantage stage where they will be benefiting, because currently these workers, they are so much vulnerable. They don't have any statutory benefits. So as SATAO, through COSATU, I think these are the key points that we have highlighted, and we have embarked on the national shutdown on the 7th of October, where we have identified issues that are affecting workers, the reversal of all gains that were made through collective bargaining. So hence we have embarked on that strike. And with SATAO's position, have identified these 10 points in these challenges. We believe that the formalization of the SIA, it will increase social security. It will also decrease poverty, create better business opportunities in the transport industry, and eliminate exploitations. It is much easier to exploit vulnerable workers groups in the informal sector, as there are no proper regulations and monitoring. And women and young and youth are vulnerable groups in South Africa. So formalization will stave off exploitation and protect these vulnerable workers. And it will also create more jobs than compared to informalized style. And the better quality of jobs, as young women are more likely to have poor quality jobs compared to the male counterparts because of gender-specific constraints and discrimination, and increase access to finance. We know, comrades, that women currently, we don't have access to lending. We don't, when we go to banks, we are not financially financed because we are unemployed, or we are in an informal sector. But SIA should absorb these workers. They will be in a better position of being financed to start their own small businesses or wherever they will be, and foster development.
Thank you very much, Beatrice. That is well done and well said. Formalization. We have picked up that the union supports the Uber drivers. That is the digital driving. Of course, the women are a handful in that sector. SATAO supports formalization, and this has its own benefit, that with formalization of employment, we'll get women will become financially viable. It will eliminate discrimination. Formalization of jobs will also create the avenue for pension and social security. It will create more jobs for the young, and it will also protect the workers. It will also provide an avenue for a better working condition. Thank you very much, Beatrice from SETAO. Let me now take this opportunity to introduce our last speaker, that is Naomi Njeri Ngugi from Kenya, who is going to take us through the Nairobi Union demands as a result of COVID. Naomi, the floor is yours.
Thank you. I'll start my presentation union demands, and I will start with the first demand, which is adequate, the demand of adequate and appropriate personal equipment. That is to highlight the impact of COVID-19 on the lives of women professionals working in public transport by demanding the provision of hand washing points with clean water and soap, also provision of masks and temperature checkers. The second demand is on the access to health measures that protect women professionals working in the public transports. Thus, the unions lobbied the Ministry of Labor to enforce Section 34, Cap 1 of the Employment Act 2007 that requires that employers ensure that personal service vehicle workers access proper medicine and medical care. For example, ensuring that women who are working in the transport industry workers diagnosed with COVID-19 are allowed to take sick leaves without the fear of them losing their jobs. This consideration would motivate many personal service vehicle workers, especially women in the industry, who show COVID-19 symptoms to seek treatment earlier, rather than risk their health in fear of losing their jobs. The third demand is on working conditions that minimize the transmission and facilitate distancing. The unions in Nairobi, Kenya, together are working on the introduction of cashless payment system as it minimizes the transmission of COVID-19 with involvement of current women workers, mostly women, to ensure a just transition. As unions, we are supporting the cashless system of payment by training conductors and provisions of mobile phones for conductors to able to process the cashless payment. This move is welcome as a step towards formalization of informal public transport, which we all hope can lead to regular and negotiated fair pay for women working in public transport, reduced working hours, and the end of daily target system. Unions are campaigning to ensure that government recognizes the demand of unpaid work, that unpaid work by women is often undervalued, and that they are subject to sex discrimination and gender-based occupational segregation. So on this point, we are encouraging women professionals in the matatu industry to form self-help groups and workers' organizations to ensure their voices and roles are amplified in the transport sector, as we have seen in the short video we have just watched. Finally, unions in Nairobi, Kenya are also encouraging women in public service vehicle to actively vie for positions in the Matatu Union so that their issues are represented well in these spaces. That's all. Thank you.
Thank you very much, Naomi. We have all heard about the demands from the unions in Nairobi, and we are happy that they are also gender sensitive, and they have taken issues on women on board. Provision of PPEs. We are also looking about the issue of medical cover, the contracts, the cashless, the government response to unpaid work which is undervalued, the issue of encouraging women to form self-help groups to get an extra income, and also women to vie for positions when it comes to the elections of the union and decision making, so that women can have a voice. Thank you very much. At this point, I want to thank everybody. I want to thank all the speakers. I want to thank all the panelists for the good work that you have done. And this brings to an end of our session.
Thank you very much, Anna Karome, for such a beautiful facilitation of the session on impact of COVID-19 and women transport workers' rights. I can see we are actually joined by quite a number of the panelists that contributed to that session, and I want to give them an opportunity to give us some parting shot. I'll start with, I see Annie. Annie, can you hear me? Annie Kazembe? Okay, as Annie is getting ready, we seem to have lost her. Nice Mwansasu.
As we know, our union have trying to do a lot of effort to help workers, not only workers, but even commuters who are working, workers and the commuters. But as we know, according to the presentation I make about sanitation, as we know, in many of environment, the public toilets, we have these challenges. So I can even advise the government, even the institutions which are dealing with this project, to make sure that they help a lot toilet which are. Can you hear me?
Yes, I can. Nice.
Okay. So they can help the maintenance of the toilet which are already in very bad situation, especially Tanzania. But most of the women who are very easy to be infected, especially in this COVID-19. So I can ask the help for government and all big institutions to talk about this issue, to take women out of this list. Thank you.
Thank you very much. Nice. There's a question for, not a question, actually, a request for Claire. And somebody has asked that you kindly share Claire's email address. And it can be shared in the comment sections. So Claire, as you give us your closing remarks, also remember to kindly share your email address.
Thank you. And yeah, it's really good to be with everyone today for this session. So I guess for me, it was just to kind of reiterate what was kind of said by the different speakers. We know that the current crisis has brought into sharp focus the critical role that public transport services are playing in the economic and social life of cities. Women in particular rely more heavily on public transport to access basic services and undertake caring responsibilities. And women are also a proud part of the public transport workforce that is keeping the world moving. They're the drivers, the ticket sellers, the conductors, and they're also the less visible workers that are keeping the transport systems running through critical work such as maintenance, security, cleaning, and administration. And women are especially concentrated in these areas. And as we heard from the different interventions, the experiences of our sisters, whilst all transport workers are being severely impacted by COVID-19, there are specific and additional impacts for women transport workers, and the challenges coming out of this crisis also have the potential to exacerbate existing inequalities. So given these specific and additional impacts for women, it's imperative that the narrative and response does not exclude women transport workers, as can so often be the case. So the industry, including employers, governments, investors, working together with unions and with women's participation, action a gender responsive approach to ensure that inequalities are not reproduced, are perpetuated or intensified. And the 9 key areas for action that the ITF has identified, which cover health and safety measures, secure work, income and social protection, as well as considerations around the introduction of new technology, such as cashless payments, as well as the importance of gender impact assessments and gender disaggregated data to make sure that our responses, our policies are gender responsive. You know, those key areas for action provide a strong framework to do this. And as I said at the end of my presentation, those demands are in response to this pandemic, but the issues they address are long-standing. So as we emerge from the crisis, we have an opportunity to ensure that transport is organised to meet social and economic priorities, to make sure that existing women's rights are reinforced, that changes do not build on existing inequalities, to make sure that we look to create jobs for women in transport and build that gender equal new normal. Thank you. And I'll just put a link in the chat to the statement and also an email address. So thanks.
Thank you very much, Claire. We have Judith Lusaka. Judith, can you hear me?
Well, I can say, as you've heard from the various women participants, various experiences during this COVID period. Well, I'd like to put it out there, like, let it be an eye opener for us, because this was a pandemic that was not expected. And as women in the transport sector, I think some of those, we need some reforms to be put in place so that women can feel, they can feel comfortable, they can feel at ease when they're going to work. Let them not lack that sense of job security when such a thing happens again. And also, I would like to urge the unions, if they can work hand in hand with our women leaders, like in the national level, to help protect women's rights and to help us like feel safe and ensure that the work environment for us is as good and everyone is just comfortable going to work and not having the doubt that you can lose your job at any point or face any sort of discrimination. Thank you.
Thank you very much. I see we also have Rebecca. Rebecca, can you hear me?
The sector now has women. And so when they are taking decisions, they should take decisions that are women friendly. They should take gender-based decisions so that we are few in the industry will be comfortable working in it. And trust me, women in transport are doing marvelous work. They are doing very good, especially the women drivers. And if you look at the rate of accidents by women drivers, it is very far lower than that of men. And then we are also good in taking care of our passengers. We are passionate towards our work. And so government, private sector should think of getting more women into the industry so that the industry can grow. And then taking care of our PPEs as well, so that we also be comfortable giving up our best. Thank you.
Thank you very, very much, Rebecca. We still have Anna with us. Anna, I believe, Anna, you moderated this session so beautifully. I don't know if you have any closing remarks.
Yeah, thank you very much. My closing remark is that I would like to appeal that the transport sector be made, the transport industry may be made conducive for women to work in all over the world and promote equal pay for equal work.
Equal pay for equal work. Thank you very much.
Yes.
Do we have Beatrice? Beatrice?
No, we don't have Beatrice.
We don't have Beatrice, but somebody had actually requested for her email address. If anybody has it, maybe they could share it with the panelists or the attendees in the chat, in the side chat. Thank you very much, Anna. Am I leaving out anybody? Salami? Yes, do you have any closing remarks very briefly, please?
Good afternoon to everyone. In closing remark, from what we've heard all over, we can see women are willing and ready to work. This is a fact that nobody can deny. You see a lot of women driving tricycle, driving motorcycle, or doing all sorts of jobs to sustain the family. And whether we like it or not, the world we have today, most women are the breadwinners of their family. So we need the support of everyone, the government, the employers, the union, the international organizations, the NGOs, to support and give these women push, because they are willing and ready to work. The support that have been given to men, yes, we appreciate it, but the women are calling for support too, in terms of loans, in terms of education, so that we can all be at par in our workplace. Thank you very much.
I just wanted to give an overview of the informal transport sector of Malawi. In my presentation earlier on, I talked about the violence that takes place to women that are doing business. But then when we look at the workers in the transport sector, actually in Malawi, we don't have women working in the informal transport sector. It is unfortunate because there are several reasons why women would not want to work in the transport sector. The reasons are, number one, the culture and the mindset. It seems in Malawi, people think the job of a driver and a conductor are jobs for men. And then the work patterns again contribute because they are not conducive to women. The reasons why we don't have women in the informal transport sector is because of culture and mindset. We always think that that job is meant for men and not women. And then the work pattern, again, is not conducive to women because the work pattern, they start early in the morning around 3 and probably end around 9 in the night, which is not good for women. And then we also have a problem of public toilets. We don't have public toilets, and you know, women use toilets more than men, and therefore if they go into this kind of business, it will be a challenge to them. The other thing is women are not safe in that type of job. They are vulnerable to abuse by co-workers as well as passengers, especially when they're knocking off at night. And then the employer also is another one that gives no chance for women to work in that sector. We have women that have got minibuses, owning minibuses, but they employ men. They don't employ women, which means they don't support women to do that kind of work. The other thing is, when you look at the Employers Association, they don't have, especially for minibuses, they don't have women there to represent other women. So in this case, this industry is shunned. And then the other thing is workers in the informal sector do not, especially women, they don't have a chance in this sector because of abusive language that is used most of the times. And therefore, you'll find that the few women that we had in this type of sector, the informal sector, they all left. At the moment, there's really nobody who is a driver or who is a conductor in this sector. Now, coming to the COVID impact. In the time of COVID, for those women that are doing business, they've been affected because the borders were closed, and also local transport. There's a restriction on how many people should be on the in the minibus. As a result, the minibus fares have gone really up, making it difficult for women to do business. And even the seating capacity, it has been reduced greatly. Therefore, there is really a problem indirectly to women, those who are doing business. So as a result, you find that the unions at the moment, they've really done nothing. I should accept that we have done nothing. And therefore, we have actually had an opportunity in this conference. It has given us an eye-opener. I think from this conference, we'll see how we can tackle this issue to have more women working in this sector. And surely we'll take seriously what Anna said last time, to say maybe we should pay a visit to Uganda and maybe Kenya and learn how it is done there so that we can introduce that in Malawi. And if we do that, I think we are going to help the government to create more jobs, because at the moment that's their objective, to create more jobs. They're saying 1 million jobs, and therefore we can actually lobby government to help us create jobs in this sector so that women can also be given an equal chance. Thank you very much.
Thank you very, very much, Annie. And allow me to say a big thank you to Anna Karume for a wonderful facilitation of that session, and every panelist that managed to listen in and also give a presentation before. That is Claire, Rebecca, Naomi, Judith, Annie, Salami, Beatrice, Nice, Aisha, and Irene. A big thank you for making this very, very successful and very, very informative. Remember, if you haven't joined on our poll, you haven't given information in the poll that we've been putting up on this site, kindly remember to do so before you are done. There'll be a link to that at the end of this webinar.